Who does Kawasaki's disease most directly affect? Kawasaki's disease is mostly common between children that are 1 and 2 years old. Rarely do you see a child around the age of 8 years old get the disease. It's really unlikely. Below I have 2 pictures of myself. The very first picture is of me. I think I was maybe a month shy of my 2-year birthday. I was in the hospital. Not only did I have Kawasaki's disease, I think it's called RSV. I had that 5 times. So I was a hospital baby. And then the picture on the right, that is me. I think my mom said that was right after they found out I had Kawasaki's disease. They were taking pictures of my face to show, the effect it had on me. You can see my red lips and how they're kind of swollen, and my red cheeks. My palms, you can't really tell, but my palms were peeling really bad. I wish I could find that picture, but we have so many in my house, it was hard to find. How does the body react to this disease? Children who are infected with Kawasaki's disease have an immediate inflammation of the blood vessels. This tends to be severe along with other symptoms for at least several days. Like I said before, children that are treated for Kawasaki's disease will probably be fine within a week. Children who are not seen by a doctor do run the risk of having heart problems as an adult. Is Kawasaki's disease dangerous? That was one of the many questions that my mom asked the doctor because no one was really too sure, what Kawasaki's disease was. Some of the information we found out was many of the children diagnosed with Kawasaki's disease have a fast recovery with no long-term effects. Nearly 1 out of every 5 children who are not treated for Kawasaki's disease do run the risk of having damage to the blood vessels that supply blood to the coronary arteries. This leading to the possibility of the arteries enlarging and causing an aneurysm, or even making the child more susceptible to having clots. Children who are affected by any damage are more likely to have a heart attack as a young adult. So to answer your question, if you're treated as soon as you see the signs of the symptoms, you're most likely not going to have any problems as an adult. But if you do wait or don't go see a doctor immediately, you are going to run the risk of having clots or having heart problems as a young adult. How is Kawasaki's disease treated? The treatment of Kawasaki's disease is through medication. You don't really treat the disease, but what you do treat are the symptoms. Early treatment can reduce the risk of blood vessel and heart damage, like we've talked about before. If the diagnosed child is treated within 10 days after the first sign of symptoms, his or her risk of heart disease and or aneurysms greatly decrease. Long-term care for Kawasaki's disease may be needed, which may include limited physical activity, repeated testing, and continued medication. Kawasaki's disease facts. I always find the facts kind of fun because it allows me to put in my mind, how serious something is and kind of get a visual. So I thought this would be a cool way of giving y'all a visual of my disease. Highest count of Kawasaki's disease is in Japan. It was 175 children per 100,000. 80% of patients are younger than 5 years old. Kawasaki's disease affects boys more than it does girls. Kawasaki's disease is uncommon in Caucasians. Between 2,000 to 4,000 cases are identified each year in the U.S. 20 to 25% of untreated children develop coronary artery problems. History of Kawasaki's disease. Unfortunately, I couldn't find a lot of information, but below is a picture of Kawasaki himself. He was born in 1925 and was a pediatrician from Japan. When reading about him, he first saw Kawasaki's disease in 1967. It was originally described as some type of lymph node syndrome. A lot of children in Japan were being diagnosed with this disease, and there were a lot of children that were actually dying from it. He was the first one to recognize the symptoms and recognize the disease, and the English version of his description was translated in 1974. Here's a list of my sources. I don't really know if you want me to talk that much about my sources, but I will say the Children's Hospital is where I got the picture of my heart. The AmericanHeart.org and the Yahoo Health were extremely helpful in giving me tons of information and facts. And then the AAFP, that's where I found a lot of facts as well. The two, well, one's a book and one's an article. The New York Times Magazine article was extremely interesting. I found that on TechShare, and as well as the Jennifer Fleming. In there, it has some of the descriptions from Kawasaki himself. So both were pretty interesting to read.